So, if you look at a successful adult, someone who has the college degree, holds down a demanding job, maybe even manages a whole household.
Right. They just look totally put together on paper.
Exactly. It's incredibly common to just assume that their internal life matches that calm, collected exterior. You see them hitting their deadlines, showing up to the meetings, and you just naturally assume everything is running smoothly under the hood.
Yeah, but if you're listening to this and you happen to be one of those people, uh, you might know firsthand that this assumption just completely shatters behind closed doors.
Oh, absolutely. Because what we're looking at is a hidden landscape
Yeah.
where that outward success is masking a constant, exhausting internal scramble. I mean, a scramble just to start basic tasks or to regulate your emotions when things go even slightly wrong.
It is the absolute definition of an invisible struggle. And, for decades, that specific struggle has been completely mislabeled. Society, and honestly, even a lot of the medical community, looks at that outward competence and concludes that, well, if you have your life together, you can't possibly be struggling with basic cognitive functions.
Because if you ever feel like you're just fighting your own mind, understanding these mechanisms will show you exactly how to objectively measure what's happening. And, more importantly, how specialized training can fundamentally rewire it.
Let's start by dismantling the stereotype that causes so much of this misdiagnosis in the first place, right?
Yeah, because when most people hear ADHD, the immediate image that pops to mind is like an 8-year-old boy literally bouncing off the classroom walls.
Exactly. And because of that highly visible childhood stereotype, millions of adults are either misdiagnosed or just suffering in total silence. The crucial misunderstanding here is that ADHD is a neurodevelopmental condition.
Right, meaning it starts when you're young.
Yes, it begins in childhood, but the physical hyperactivity doesn't just, pack its bags and leave when you turn 18. What changes is the presentation. The underlying brain physiology is still there.
But as you grow up and learn social norms, that physical bouncing off the walls just moves inward.
Exactly. It moves from the body into the mind.
So instead of a kid jumping on the furniture, you have an adult sitting perfectly still at a desk looking completely calm, but internally their mind is racing a million miles an hour.
Yeah, if you've ever felt that constant low hum of anxiety, that feeling that you should be doing something else, a chronic inability to just sit and relax even when you actually have downtime, that is the internalized hyperactivity.
And this leads directly into a phenomenon Dr. Ray refers to as the success trap.
Oh, the success trap is so common. Because you don't fit that hyperactive child stereotype, and because you might have a good salary or a stable relationship, doctors frequently just dismiss the possibility of ADHD altogether.
Right. They look at your career success and basically tell you that you're doing fine.
But the extreme exhaustion and the burnout that comes from masking those symptoms for years, I mean, that constant mental spinning gets completely misdiagnosed. A doctor will look at that fatigue and label it generalized anxiety or clinical depression.
Which leaves the root cause completely untreated. And this is often compounded by something called time blindness, right?
Yeah, time blindness. Adults with ADHD often have a profoundly inaccurate internal sense of how much time has passed or how long a task will realistically take to complete.
And that isn't just you being bad at scheduling.
No, it is deeply rooted in the structural timing functions of the cerebellum and the frontal lobes. Your internal clock is literally skipping beats.
Man, it sounds like upgrading from a loud, rattling gas-powered engine to a silent electric car. But while you're sitting in standstill traffic, looking perfectly calm on the outside, your internal motor is secretly redlining at 10,000 RPMs.
That is a brilliant way to visualize it.
You aren't moving, but you're burning out the engine.
The outward noise stops, but the internal machinery is just overheating.
Okay, so we know what it feels like for the listener experiencing this. Let's get into the mechanics of that engine. Dr. Ray takes us straight into the physical brain structures to explain exactly how this happens.
But before we get to the part of the brain that's struggling, we have to understand the noisy background it's fighting against, right? We need to talk about the default mode network, the DMN, and the basal ganglia.
Right, so the DMN is essentially the brain's resting state. It's the network that lights up when you're daydreaming, thinking about the past, or just letting your mind wander.
Yeah, and in a neurotypical brain, when it's time to focus on an external task, the DMN reliably quiets down. It hands the stage over to the task-focused networks.
But in the ADHD brain, the DMN keeps intruding. It's like a radio playing in the background that you literally can't turn off.
That is exactly why you might mentally leave a conversation without meaning to. Your DMN just hijacks a moment.
And then you have the basal ganglia, which sits deep in the brain, and it acts almost like the gas pedal. It works heavily with dopamine to regulate your motivation and reward center.
Right. It basically decides how rewarding a task is going to be before you even start it, which completely explains why some adults with ADHD literally cannot initiate a task unless there is intense urgency, panic, or massive stimulation.
Because the basal ganglia isn't providing the dopamine necessary to press the gas pedal for like mundane tasks.
Exactly. So you have a noisy radio that won't turn off and a gas pedal that won't engage.
Which brings us to the part of the brain trying to manage all of this, the prefrontal cortex. If the brain is a car and the basal ganglia is the gas pedal, the prefrontal cortex feels like the transmission.
The transmission is a perfect analogy. The prefrontal cortex sits right behind your forehead, managing all your executive functions.
It's supposed to take the power, filter out the distractions, inhibit your impulses, and shift you into the right gear to get the project done.
But in the ADHD brain, research consistently shows a pattern of delayed cortical maturation. The structure isn't damaged, it just runs on a different developmental schedule. It really struggles to shift gears smoothly.
And this is where objective measurement completely changes the game. We aren't just guessing about this anymore. Dr. Ray introduces a clinical tool called FNIRS.
Yeah, functional near-infrared spectroscopy. It measures the physical blood flow in the brain. It acts as a direct fuel gauge.
How does it actually do that?
Well, it shines near-infrared light through the scalp. And because oxygenated blood and deoxygenated blood absorb that light differently, the sensor can read exactly how much a specific brain region is, like lighting up with fresh blood when you're trying to do a task.
So when someone is sitting at their desk staring at a blank document and they're just begging their brain to start typing, what does the FNIRS actually show?
It consistently shows prefrontal hypoactivation. When an adult with ADHD is asked to do a task requiring sustained attention, their prefrontal cortex, that transmission, shows a significantly smaller or slower increase in blood flow compared to a neurotypical brain.
So the metabolic fuel is literally not arriving in sufficient quantities to do the work.
Exactly. The blood isn't getting there.
Wait, I have to challenge this logic for a second. You're saying the brain literally doesn't have the metabolic fuel, the oxygenated blood, to focus on the document, but adults with ADHD are notorious for hyperfocusing.
Oh, right.
Like, they might not be able to write an email, but they can play a complex strategy video game or go down a deep research rabbit hole for 6 hours straight without eating or even blinking. How can they possibly do that if the fuel gauge is empty?
That is the exact paradox that confuses so many people, doctors included. The key is that the fuel gauge isn't permanently empty. It's dependent on stimulation. Remember the basal ganglia and dopamine we talked about?
Yeah.
When an activity is novel, highly stimulating, or intensely interesting, like a fast-paced video game, your brain gets a massive surge of dopamine.
It's like injecting nitrous oxide into the engine.
Exactly like that. That surge of dopamine overrides the system. It essentially forces the blood flow and activates the prefrontal cortex, allowing for that intense hyperfocus.
But you can't rely on nitrous oxide to drive to the grocery store.
Right. For mundane, everyday tasks, the spreadsheets, the laundry, the emails, the baseline dopamine just isn't there. The blood flow lags, and the transmission simply won't engage.
Man, that distinction is incredibly validating. I mean, it completely differentiates a biological metabolic lag from, like, a moral failing or a lack of discipline. You physically cannot just try harder to make blood flow to your forehead.
You can't. And blood flow is only one half of the equation anyway. If the blood is the fuel, we also have to look at the spark plugs. We need to transition from metabolism into the brain's electrophysiology.
The electrical grid of the brain. So Dr. Ray uses a QEEG, or quantitative EEG, for this. You place sensors on the scalp to map out the electrical brainwaves. You've got your slow waves, like delta and theta, and your fast waves, like beta and gamma.
Yeah, and to give you a tangible sense of this, theta waves are slow. That's the electrical pattern your brain produces in that drifty, daydreaming state right before you fall asleep. Beta waves are fast. That's the pattern your brain produces when you're highly alert, actively solving a complex math problem or engaging in a deep conversation.
And when you run a QEEG on a classic ADHD brain, the signature that pops up is an elevated theta to beta ratio, specifically in the frontal regions.
Which means the transmission has way too much of that drowsy, daydreaming electrical activity and nowhere near enough of the fast, alert activity required to do the job.
In clinical terms, this reflects cortical underarousal, right? The brain is essentially running at a lower level of electrical alertness than the external task requires,
Exactly.
which feels totally backward. I mean, if you have adult ADHD, you feel mentally restless, overwhelmed, and constantly on edge. How can the brain possibly be underaroused when it feels like a tornado in there?
Because that feeling of restlessness, that constant mental fidgeting, tapping your foot, seeking out urgency, it is the brain's desperate attempt to self-stimulate. The brain knows it's under-aroused. It's trying to force those fast beta waves to wake up the prefrontal cortex so it can function. The internal tornado is a coping mechanism for an underpowered grid.
Which perfectly explains why symptom checklists alone are so incredibly dangerous. If you just fill out a questionnaire at a doctor's office and check a box that says, I have trouble focusing and I feel restless, the doctor might just hand you an ADHD diagnosis.
Oh, happens all the time.
But severe sleep deprivation, hidden trauma, and chronic anxiety all cause trouble focusing and restlessness.
This is why the multimodal assessment, like actually measuring the physiology,
Right.
is just non-negotiable.
Yeah.
We look for convergence versus divergence in the data.
Right.
Let's say you come in complaining of poor focus and emotional volatility. The questionnaire says ADHD, but we run a QEG, and instead of seeing that slow, daydreamy theta ratio, your brain lights up with highly elevated fast-frequency beta arousal everywhere. Your brain is electrically screaming.
So that divergence means the symptoms look like ADHD, but the electrical signature proves it is actually severe chronic anxiety.
Precisely. And if a doctor treats that highly aroused, anxious brain with standard ADHD stimulant medications, it's like pouring gasoline on a fire. You're going to send that nervous system into overdrive and make the problem significantly worse.
The treatment protocol needs to be entirely different based on the electrical data, not just the subjective feelings.
Absolutely.
Okay, so we've mapped the fuel with the FNRS, and we've mapped the electricity with the QEEG. But to really understand the emotional volatility of adult ADHD, those moments where frustration just boils over instantly, we have to move down out of the brain and into the body.
Right. We have to look at the autonomic nervous system. And the tool Dr. Ray uses here is HRV, or heart rate variability.
Now, most people think a totally steady heart rate is a good thing, but HRV actually measures the tiny millisecond variations in time between your heartbeats, and you want high variability, right?
Yes, you do.
Because a highly variable heart is flexible, it can adapt to stress quickly. A perfectly rigid metronome-like heart rate actually indicates a system under chronic stress.
That is spot on. HRV reflects the real-time tug-of-war between your sympathetic nervous system, which is your stress or go response, and your parasympathetic nervous system, which is your calm or break response.
And that parasympathetic break is largely controlled by the vagus nerve, right? That massive nerve wandering from your brainstem down through your chest and abdomen.
Yeah, and the sources specifically note that adults with ADHD often exhibit lower vagal tone, meaning their physical autonomic brake pads are worn out.
Think about how directly this explains emotional dysregulation. When you get frustrated, maybe you drop your keys or an email comes in with a passive-aggressive tone, your reaction is big and fast.
Because you lack that top-down inhibition from the delayed prefrontal cortex, the transmission just can't filter the impulse.
But worse, because your vagal brake is structurally weak, your physiological come-down takes much, much longer. Your heart rate stays elevated, your muscles stay tense, and your nervous system simply has a harder time settling back into a calm state.
Right. So when well-meaning people tell someone with ADHD to just take a deep breath and calm down, during an emotional spike, they're basically yelling at a car with totally worn-out brake pads to stop faster.
The physical mechanism required to execute the command, just calm down, is biologically weaker.
It is. And in the clinic, this slow recovery time is a massive differentiator. If you're dealing with pure anxiety, your HRV usually shows constant high sympathetic arousal. You're just always stuck in a threat state.
But with ADHD, the issue is often that slow, highly variable recovery after a specific stressor.
Exactly.
This is a profound shift in perspective. We now have a complete objective map of the problem. We know the oxygenated blood flow is blunted, we know the electrical activity is under-aroused, and we know the nervous system's brake pads are worn out.
Which brings up the inevitable question.
Right. How do we fix it? We aren't just measuring this to feel bad about it. Dr. Ray outlines specific non-pharmaceutical interventions designed to fix these exact physical deficits.
Let's start with the electrical grid. To fix the under-aroused QEEE patterns, clinicians use neurofeedback. This is essentially operant conditioning for the brain's electrical activity.
How does that work in the room?
You sit in a chair, sensors are placed on your scalp to read your live QEEG data, and you watch a video or play a simple game on a screen.
And the brilliant part is that the game only plays smoothly when your brain accidentally produces the desired electrical pattern. If the goal is less drowsy theta and more alert beta, the moment your brain shifts into that better state, the game moves forward, the movie gets brighter, the audio gets clearer.
And the second your brain drifts back into a daydreaming theta state, the screen dims and the game pauses.
That is so cool.
What's critical to understand is that there is no conscious effort here. You aren't trying to push a button or lift a weight. The brain learns implicitly through this immediate subconscious feedback loop.
It's very similar to learning how to balance on a bicycle, isn't it? You can't explain exactly which muscles you're flexing to stay upright. Your body just figures it out through trial and error.
Exactly. And over the course of 20 to 40 sessions, the brain learns to self-regulate its own electrical states. It strengthens the grid.
Okay, that covers the electricity. What about the fuel? To address the blood flow issue we saw in the FNIRs, Dr. Ray utilizes EWO, exercise with oxygen therapy. What does that actually look and feel like for the patient?
Oh, it's intense, but incredibly effective. You get on a stationary bike and perform moderate to high-intensity aerobic exercise. But while you're pedaling, you're wearing a mask connected to an oxygen concentrator, breathing a much higher concentration of oxygen than you'd get from normal room air.
Connecting this back to the FNIRS findings of prefrontal hypoactivation, the transmission not getting enough fuel, this makes perfect mechanical sense. The physical exercise gets your heart pumping, forcing increased blood flow throughout your entire body and up into your brain.
Yeah, and because of the mask, you're supersaturating that incoming blood with high-density oxygen.
You are essentially force-feeding premium, oxygen-rich fuel to a brain region that chronically underactivates.
This floods the area with the resources needed to support the mitochondria, the powerhouses of your cells, directly addressing that metabolic lag at a cellular level.
It sounds like going to an intense boot camp for your brain. But I have to ask the obvious question. Just like a regular gym, if you stop the neurofeedback or the EWOT, do all these cognitive games just melt away? Or are you fundamentally rewriting the brain's default settings permanently?
Well, because neurofeedback relies on that genuine implicit operant learning, just like the bicycle analogy, research shows the improvements often have remarkable durability long after the training ends.
Oh, wow.
You've taught the brain a new skill of self-regulation, and it tends to retain that skill. Now with EWOT, the metabolic and mitochondrial support creates a much stronger structural baseline, though to maintain optimal blood flow benefits over a lifetime, maintaining some form of regular aerobic exercise is usually necessary.
Which brings us perfectly to the other 23 hours of the day, because no matter how great the clinic interventions are, they only take up a tiny fraction of your week.
Right, Dr. Ray's background in chiropractic neurology heavily emphasizes that the brain and the spinal cord are one continuous network. You cannot isolate the brain, train it, and then just ignore the physical body it sits in.
Holistic lifestyle integration is the foundation that the neurooptimization stands on. For instance, we talked about dopamine acting as the nitrous oxide for the brain's transmission. Nutrition directly dictates your body's ability to create that dopamine.
Dopamine isn't just a magical feeling of happiness, it's a physical neurotransmitter synthesized from amino acids.
Wait, so if I skip breakfast or eat a diet composed entirely of highly processed carbs, my body literally doesn't have the raw chemical building blocks to manufacture dopamine that day.
Exactly. Ensuring you have adequate, high-quality dietary protein provides the direct amino acid precursors your body requires to supply that reward circuitry. You're feeding the engine the raw materials it needs to build the chemicals.
And then there's the vagal nerve stimulation. We talked about those worn-out autonomic brake pads. Dr. Ray outlines how you can literally train your parasympathetic brake with simple daily habits.
Things like paced breathing, bringing your respiration down to about 5 to 6 deliberate breaths per minute, or exposing your face to cold water to trigger the mammalian dive reflex.
But the intervention that completely blew my mind was humming.
I know it sounds almost too simple to work, but the anatomy totally backs it up.
The vagus nerve passes directly down through your neck, right past your vocal cords, right?
Yes. So when you hum, chant, or sing loudly, you vibrate the vocal cords. That physical mechanical vibration actually massages and stimulates the vagus nerve, which increases your vagal tone over time.
It is incredibly fascinating that something as accessible as humming could be a literal mechanical lever to activate a biological brake on your emotional state. You don't need expensive medical gear or a prescription for that. You just hum in your car on the way to work.
This holistic view is where the multimodal assessment truly dictates the care plan. Dr. Ray's book references composite case studies that show exactly how this plays out.
Like if you walk into a clinic and your data shows that your primary driver is massive emotional dysregulation and severe autonomic dysfunction, your brakes are completely shot.
Right. A good clinician won't just throw you into neurofeedback right away. They might prioritize the HRV vagal work, the paced breathing, the nutrition, and the humming first.
Because you have to fix the brakes before you start trying to upgrade the engine's electrical efficiency. It all comes down to treating the specific, measured physiology of the individual.
Absolutely.
When we look at all of this together, the ultimate message of Dr. Ray's work is profoundly empowering. If you've been fighting that silent internal scramble your whole adult life, his data proves that you do not have a broken operating system.
You were not dealing with a character flaw.
You possess a unique, measurable physiology. By combining QEEG for the electricity, FNIRS for the blood flow, and HRV for the nervous system, the era of guessing is just over. We can stop relying on vague symptom questionnaires, start seeing exactly what your brain is doing in real time, and finally train it effectively.
And, looking at the trajectory of these measurement tools raises a really provocative final thought for you to explore on your own. The book gestures toward the rapid advancement of wearable, longitudinal monitoring. Sensor technology is shrinking fast.
Oh, for sure.
We are rapidly approaching a point where we'll be able to continuously track our own brain's electrical and metabolic states right at home.
Like checking your daily step count on your watch, but for the blood flow in your prefrontal cortex.
Exactly. Think about the societal implications of that. As this technology becomes mainstream and cheap, will focus eventually stop being viewed as a moral or personal virtue altogether.
Wow, yeah.
If managing our cognitive engagement becomes as routine and data-driven as tracking our daily heart rate or our sleep cycles, it could fundamentally shatter how society judges human productivity and worth.
We might finally reach a point where we stop judging people for the noise of the traffic and start understanding exactly what it takes to keep that silent electric car from redlining. Thank you for joining us on this deep dive. Keep asking questions, keep looking under the hood, and we'll catch you next time.